Steve, thank you. A health alert this morning: if you use chemicals to straighten your hair. If that's you, you may be at a higher risk for cancer. Scientists at the National Institutes of Health reported that people using chemical hair straightening products more than 4 times in the previous year were more than twice as likely to develop uterine cancer. Verywell Health Chief Medical Officer Dr. Jessica Shepard joins us live to help break down this pretty troubling report here. Good morning to you. Thanks for joining us, Dr. Shepard.
Good morning, Jeanette. How are you?
Good, good. So break down just kind of broadly what prompted this study and what they found.
Now, this is not a study that is new. I think that this is something that we've looked at in previous years, but I do just want to start off with giving caution to how headlines are read, because this can be quite alarming to anyone who may have used a relaxer, including myself, or in the past. And so it is very important from a healthcare perspective, and as a physician, when I have women who come into the office, is to help people understand exactly what this means for them individually and how this can increase the risk and what is that risk.
And to your point, actually, I do want to get to that because it says it doubles the rate of cancer. They saw that it doubled it, but it puts it at 4%. So the number is still fairly small, and uterine cancer itself is extremely rare, correct?
Well, uterine cancer is not necessarily rare, but when you look at reproductive cancers, it is one of the top reproductive cancers that we do see in women. So when we look at risk, and I'm glad you brought it up that way, is when we look at risk factors that include, say out of 100 risk factors, what is that's going to actually be linked to, again, chemical relaxers? And they also did look at hair dyes as well, because that's also what we consider what we call hormone disruptors, and that is even falling into the makeup category. So there is, again, a link between hormone disruptors and the use of chemical relaxers and what that risk is going to be. Now, if I were to say, someone were to come into my office and say, hey, I use relaxers, should I stop because I don't want to get cancer? I think that's the more important question. And when we look at risk of uterine cancer and what increases that risk, I would probably spend more time looking at the things that increase substantially, including, again, our bleeding, our obesity, our eating. And then if you have, again, heavy bleeding, or if you have bleeding after menopause, these are actually more things that are going to increase your risk. Diabetes and hypertension also increase the risk of uterine cancer. So it really is in the pocket of risk factors. Where does this fall? What should I do as an individual? And I think that this study is important in the fact that we need to look more into it, which is actually what their conclusion was, is that we do need to pay more attention to this. But in the realm of uterine cancer and risk factors, where does this fall and what does it mean to me individually?
It's good to have that perspective. Just so that folks can get it in practical terms, does this mean lessen the frequency? Because they mentioned 4 times in the past year.
Yeah, they actually looked at like 4 times greater than 7 times a year. And I think what was interesting is that they felt that it was a concerning increase related to the use. So I would say to people, if they feel that they want to be reassured with decreasing their risk of uterine cancer, this is a possible way to look at it from a lifestyle perspective. If I decrease the use of using, certain chemical relaxers, I know that I can be a part and play a part in decreasing my individual risk of having uterine cancer.
All right. Thanks for the perspective, by the way. A lot of caveats there, but good to know about that. All right. Verywell Health Chief Medical Officer Dr. Jessica Shepard joining us this morning. There's her information if you'd like to give her a follow. Thanks again.